Good morning, friends. I'd like to start by thanking Sambodhi for the invitation and the honor of sharing the stage with these two stalwarts of development in India. I am going to be restricting my remarks specifically on the intersection of health, public health, and the development challenges that our country faces. And I want to start with the proposition that we will not realize 1 billion dreams unless we realize the right to health for the billion Indians who have dreams. And I want to really draw upon my remarks on an article that I wrote with a number of others that was published a few months ago in the Lancet Medical Journal called Assuring Health for All in India. And I want to organize my remarks in 3 parts. First of all, why should we consider health as a central development priority in our country today, not as a health concern, but as a development concern? Secondly, how is health being addressed in the Sustainable Development Goals era? And thirdly, what should be the way forwards? And I certainly would like to draw inspiration from Vijay's remarks that I think the way forward has to be in driving a completely new way of thinking about development. And my arguments will be that one of those new ways of thinking about development is that health lies at the very heart of what we think about human development. So why should we be concerned about health in India? For all that we hear about the remarkable success that India's private sector has made in health and all the wonderful celebrations about India's medical successes, let me give you some blunt facts. India is one of the worst performing nations given its economic status in terms of its health indicators. India accounts for more of the global burden of disease than its population would demand. About 1/3 of our children are stunted or malnourished. India currently sees one of the worst epidemics in the world of tuberculosis. And even while we are still struggling with conditions like TB and malaria, we are seeing one of the worst epidemics of cardiovascular disease and diabetes. By some estimations, about 16 million productive life years of life will be lost in young Indians because of the burden of cardiovascular disease and diabetes over the next decade. India is the world's capital of suicide. Suicide now kills more young Indians, and this is, of course, as a mental health expert, an issue of grave concern to me. Can you believe that suicide now kills more young Indians than any other cause of death? And more youth kill themselves in India than virtually the entire rest of the world combined. And yet, while we have these enormous health challenges, other countries are speeding ahead of us. We are very proud to be part of the BRICS club, yet India's health indicators are shameful compared to those of China, Russia, or Brazil or South Africa. And mind you, South Africa has one of the worst HIV epidemics in the world, which we do not have. But perhaps even more embarrassingly for our policymakers and a development sector, even our neighbors, much poorer than us and who have not had 2 decades of economic growth, are speeding ahead. Bangladesh's health indicators now put India to shame. What an amazing fact that might be. And while all of this is happening, our healthcare system continues to plod on, desperately underfunded, completely fragmented, and every single day we see stories that tell us what a human tragedy is being played out because of the catastrophic quality of care. The tragedy of sterilization deaths in Chhattisgarh last year, the tragedy of infected blindness following a routine cataract surgery camp in Punjab. There are so many countless examples of such tragedies every day. We heard from the very first speaker that inequality is a huge problem in our country. Certainly, if you look at health indicators, and I was very impressed by the health indicators on life expectancy, for example, there are massive inequities in India, not just the traditional rural-urban ones, but also between the backward castes and the rest of the community, between different states in the country, between men and women, and between, of course, the rich and the poor. Equally disturbing is the consequence of a failed healthcare system on the economic well-being of our people. And perhaps a less well-known fact about India's medical system is that healthcare costs today are amongst the leading causes of impoverishment. About 30 or 40 years ago, I read an economic book that said that marriage was one of the leading causes of impoverishment in India. That is to say, people went into debt, and had to have distressed sale of assets, for example, when their daughters got married. Today, It is when someone falls sick in your house. One of the less well-known facts about the triggers to farmer suicides in Vidarbha is that the commonest trigger is not crop failure, it's a sickness in the family. I want to turn to the second part about where does health sit within the SDGs. And I think it is quite important to recognize the SDGs because India did not only sign on to the MDGs and does annually report its progress on the MDGs, showing that we are concerned about how the world sees us, but we have also signed on to the SDGs. And where does actually health figure in the SDGs? Well, for those of you who are familiar with the SDGs, you'll know there are 17 goals. The MDGs had only 8 goals. And in the MDGs, out of the 8 goals, 3 were explicitly health goals. But in the SDGs, we've got more than a doubling of the number of goals, and health has shrunk to just the 1 goal. So it might look that actually health has lost its importance. In fact, that is not the case. In my view, the way the SDGs have been framed, health lies as a central cross-cutting issue across many, if not all, the Sustainable Development Goals. And this is because a very significant amount of the burden of health problems in every population are linked to the other Sustainable Development Goals that are recognized in the document. Indeed, a very large proportion of the inequalities that we see in health are due to these SDGs. And I want to just draw a few examples of those SDGs that will profoundly affect the health of our people. Inequality is by far the single and most important one, and we've heard a remarkably good expose of that right at the beginning. But inequality, I don't only refer to income inequality, but also to gender inequality, which remains a profoundly important factor in explaining the poor health of India's women, children, and indeed our whole population. Inequality in access to public goods like clean drinking water and sanitation is another extremely important sustainable development goal. And there are some new challenges that we are facing. The most important one, climate change. Who can miss the fact that hundreds of people are dying in Telangana right now because of heat waves? And mind you, we're only in April. And of course, the age-old scourge of hunger and malnutrition. Nutrition in itself is a goal in its own right, but of course, malnutrition is also linked to a whole range of health problems. In other words, action on these SDGs, in my view, will probably produce the most significant impact on health. It's not healthcare which is going to actually reduce the burden of disease, it's actually sustainable development which will. However, as a doctor, I am also concerned about our healthcare system. And our healthcare system is deeply troubled in a number of different ways. And I want to just summarize a few of the key challenges that India's healthcare system faces. First of all, we face a very weak public primary care system. For example, more than half our district hospitals do not offer intensive care. These are district hospitals, mind you, not primary health care. Secondly, we have an extremely unequally distributed and unskilled human resource in health. Vast sections of our population still have to resort to quacks when they fall sick. And only 4% of all the doctors in our country actually live and work in a rural area. The third is we have a large and completely unregulated private medical sector. Today, more than 60% of all healthcare expenditure is taking place in the private sector. And this private sector is not only unregulated, but it has been affected by corruption at every single level, from medical education right through to the collusion of the medical industry with pharmaceutical and technology industries. Fourth, we have very low public spending on health. Only about 1% of our GDP is spent by the state on health. This makes us one of the least public expenditure in the whole world. And of course, this might explain why India's health indicators are so poor. It isn't surprising then that if the state is spending so little on health, it is your personal expenditure, the out-of-pocket expenditure, that accounts for about 70% of all health expenditure in India. And of course, this then leads to catastrophic health expenditure. Fifth, we don't know what the status of health is in our country. Our health information systems are inadequate. We have multiple health information systems, but none of them talk to each other. So we have the peculiar situation that we do not know why people die in our country. Nearly 2 out of 3 deaths in our country go without a cause of death. Sixth, we have a very irrational use of drugs and technology consider the very high rates of cesarean surgery and knee replacements that are restricted to the super rich. That tells you something about how these sorts of procedures are being used irrationally. And finally, there is very weak governance and accountability systems that account for the fact that we have such poor quality and corruption in healthcare. I want to finish by thinking about what the development agenda may look like in the future. I think, first of all, we need to be thinking of health as central, not a peripheral aspect of development, but as a center of development. And this means thinking of health in all our macroeconomic and social policies. For example, when we tax tobacco, it is absurd that we do not tax bidis, the single most important tobacco product of the poor in our country. For example, when we have dialysis machines being rolled out in our health budget in order to help treat the ultimate complications of kidney failure, which is due to diabetes, why are we not taxing the high sugar and processed foods that actually lead to diabetes in the first place? Why are we not considering policies to promote health and well-being? For example, going well beyond the Swachh Bharat Abhiyan to look at clean air and water across our environment. And above all, amongst all the social policies, seems to me empowering gender and ensuring gender equity will probably produce the best returns of all in terms of health. But I want to finish again by thinking about the healthcare system, because again, we can't just simply prevent disease, as important as that is. I think we also have to think about what happens to people when they're sick. One of the most important targets of the Sustainable Development Goal for health is universal health coverage. And I think this has to be the aspiration for our country. In my mind, a universal healthcare system in India means that we have a fully integrated healthcare system that weaves both our public and private, our biomedical and indigenous sectors together, but is governed by some key principles. Those principles are, first of all, that we have a very strong, fully resourced primary care system that is primarily run by the state. This needs to coordinate with a secondary and tertiary care system that could be mixed, both public and primary. And secondly, that all healthcare must be free at the point of delivery. And thirdly, our ultimate goal must be universal coverage. We may start in a progressive realization by targeting our subsidies, for example, to those who are poor, those who live in rural areas, and so on. But ultimately, at some point in our history, we must think of healthcare as a universal system. A key requisite for this, I believe, is to move away from this age-old idea of health insurance. I know many of us support this, but I believe health insurance is not the only way of thinking of universal health coverage. You would know that health insurance only reimburses the person who is sick or the hospital when you're on hospital. Health assurance is a much grander idea, and I was very enthused when the current Prime Minister actually declared that this was his goal during the elections. Unfortunately, we haven't seen much sign of that. Health assurance is more than insurance because it recognizes the centrality of the state in ensuring good health, not only when you're sick, getting repaid for what you spent, but actually preventing you from getting sick in the first place. And I think, therefore, this means a commitment to social determinants as well as accountability. I hope that delivering on the promise of assuring a healthy India is the topmost priority for the current and the future governments. I would hope that when we celebrate our 75th year of independence in 2022, that no Indian would ever have to be denied his or her right to quality healthcare, and no Indian would be impoverished because of healthcare costs. In the context of the amazing economic development that is happening in our country, in the context that we are the factory, the world's factory of doctors and cheap medicine, in the context that we have been able to do remarkable things like deploy 1 million ASHA workers, who I consider the soul of our healthcare system, I think actually this is all possible. It is not outside our reach. It is a question of our imagination and our political will. I want to end by saying that ultimately, I believe that for health to achieve this right place in development, it is important for us as a nation, and I don't mean just the government, I think this is the role of all of us, including civil society, to reject that myth, that notion that there is only health when there is wealth. The idea that we can only assure health for our people when we are wealthy enough to do so. This is a neoliberal lie. In fact, the slogan that we should adopt is that there is no wealth without health. No country has ever transitioned from being a poor country to a developed country without investing in the health of its people, and I don't believe we will either. Thank you.